New York State, finding mental health help in rural areas could be challenging. Tonight, we hear the story of a family that claims that happened to their loved one, and it turned tragic.
Tonight, our New York Capitol correspondent, Elise Klein, has our story.
Before they left for the summer, lawmakers passed a bill to establish a rural suicide prevention council. For the Tobia family, this legislation is personal. 3 years ago, Elisa and Joe Tobia lost their son Matthew to suicide. Since then, Matthew has been their motivation to improve the mental health system by making lawmakers and state leaders aware of the many barriers facing individuals trying to get help in rural counties.
One of the last things he said was why doesn't anybody want to, take care of me and help me? And, I went into this mental health care naively thinking we had resources, honestly.
Elisa says her family faced barriers such as long wait times for inpatient care, understaffing, and limited behavioral and mental health facilities close to where they live in rural Steuben County. Looking ahead, Joe says this legislation could go a long way to address some of these issues.
In the long run, it can save lives. There's
Right.
no doubt about it in my mind. It will save lives down the road.
Some lawmakers say if signed into law, the council could help improve collaboration of care and services among various state agencies. It could also help reduce the stigma around the issue.
Our kids, our younger people, people in need, people who are hurting need to know that there are services and care available for them, and we want them to access those services. And we certainly don't want the stigma of utilizing mental health services to prevent people from going forward.
In Albany, Elise Klein, Erie News Now.